You know that feeling? The one where you're completely exhausted no matter how much you sleep, or how your hands and feet feel like blocks of ice even when you're tucked under a blanket. Maybe it's that slight brain fog you just write off as a side effect of a busy life. We all experience things like this from time to time and tell ourselves it's normal. We get used to feeling less than 100% because, well, life is demanding, we're not getting any younger, and we figure everyone else must feel this way too. But what if these aren't just random, disconnected annoyances? What if they're a quiet but consistent pattern? A secret language your body is using to send out a distress signal. A warning that something deeper, something systemic, is going wrong just beneath the surface. Many people brush these symptoms off as trivial, but they could be your body's silent pleas for help, pointing to a hidden danger that often goes unnoticed until it's dangerously late: poor circulation. So, you're tired a lot, your hands are always cold, and you just dismiss it as a normal part of life. But what if your body is waving a giant red flag and you aren't seeing it? What if these are the first warning signs of a hidden danger that's silently taking hold? Ignoring these signals is a lot like ignoring the check engine light on your car. For a while you can probably get away with it. But eventually, the system breaks down, often with catastrophic results. The danger of poor circulation isn't just about being uncomfortable. It's about a progressive failure of your body's most critical delivery system, which can increase your risk for serious health events like heart attacks, strokes, and blood clots. Today, we're going to look at this silent threat head-on. We'll reveal the surprising signs of poor circulation that you might be experiencing right now without even realizing what they mean. This isn't about fear, it's about empowerment. It's about learning to listen to your body, understand its warnings, and take control of your health before a small problem becomes a big one. Think of your circulatory system as a vast network of highways, arteries, veins, and capillaries that delivers oxygen and nutrients to every single cell in your body. When that flow gets bogged down, it's like a massive traffic jam. The consequences aren't just felt at one spot. They cause problems throughout your entire system, and the signs are often not what you'd expect. Let's start with one of the most common, yet easily dismissed signs: chronically cold hands and feet. We're not just talking about feeling a bit chilly on a winter day, we're talking about hands and feet that feel cold to the touch, even when the rest of your body is perfectly warm. This happens because your body, when its circulation is struggling, prioritizes sending blood to your vital organs, your heart and brain. Your hands and feet, being the farthest outposts, are the first to have their supply reduced. While getting cold feet is normal sometimes, a persistent, progressive coldness can be an early warning of conditions like peripheral artery disease, PAD, where your arteries have narrowed. You know that pins and needles sensation you get when your foot falls asleep? That happens because you've temporarily pinched off a blood vessel. But if you start experiencing that tingling or numbness in your hands, feet, or legs for no clear reason, that's a red flag. Poor circulation means your nerves aren't getting the steady supply of oxygen-rich blood they need to work correctly, which causes these bizarre sensations. Ignoring persistent numbness is a gamble, as it can be a sign of nerve or tissue damage from a chronic lack of oxygen. Do your socks leave deep dents in your ankles at the end of the day? Do your feet and legs just feel heavy, tight, and puffy? This is called edema, and it's a classic sign that your circulation is struggling. When blood flow is sluggish, fluid can leak out of the blood vessels and pool in the surrounding tissues, especially in the legs and feet where your veins have to fight against gravity. This swelling can indicate that the tiny valves in your veins are weakened and struggling to push blood back up to the heart, a condition known as venous insufficiency. Feeling forgetful or finding it hard to concentrate? It's easy to blame stress or a bad night's sleep, and often, that's exactly what it is. However, your brain is an energy hog using about 20% of your body's oxygen. When blood flow to the brain is reduced, it isn't getting the fuel it needs to fire on all cylinders. This can show up as brain fog, difficulty focusing, memory issues, or even dizziness. It's crucial to know that brain fog is a very common symptom with many possible causes, from sleep disorders to thyroid issues or vitamin deficiencies. But if it's persistent and happening along with some of these other signs, it's worth considering if poor circulation is a contributing factor. This one surprises a lot of people. Your digestive system needs a huge amount of blood to break down food and absorb nutrients. If your circulation is impaired, your body might divert blood away from your gut to prioritize other areas. This can lead to a whole host of issues like abdominal pain, cramping, and diarrhea. Essentially, your body doesn't have enough resources to digest your food properly, which can lead to even more health problems down the line. Do you seem to catch every cold that goes around? Does a small paper cut or scrape seem to take forever to heal? Your circulatory system is a key part of your immune response. It's the transport system for the white blood cells that fight infection and the platelets needed for repair. With poor circulation, this entire process is slowed down. Wounds, especially on your legs and feet, might heal very slowly or even become chronic ulcers. This dramatically increases the risk of serious infections. Your skin, hair, and nails are often a direct reflection of your internal health. Poor circulation can starve them of the nutrients they need to be healthy. You might notice your skin becoming dry, thin, or unusually shiny. It might also look pale or have a bluish tint because of the lack of oxygenated blood. Another telltale sign is hair loss, particularly on the lower legs. When hair follicles don't get enough blood, they can't support hair growth. At the same time, your toenails might become brittle and grow much more slowly. This is a big one. Feeling tired all the time is one of the most common signs of poor circulation. We aren't talking about normal tiredness. This is a deep, relentless fatigue that never seems to lift. When your muscles and organs aren't getting enough oxygen, they can't function at full capacity. On top of that, your heart has to work much harder to pump blood through a compromised system, and that burns a ton of energy. Now, to be clear, fatigue is an incredibly non-specific symptom. It can be caused by countless other things like anemia, thyroid problems, or stress. It should never be ignored, but if this deep exhaustion is your reality, and you're also noticing other signs on this list, it's a piece of the puzzle that shouldn't be dismissed. If any of these signs are hitting a little too close to home, please know that just recognizing them is the most powerful first step you can take. If you're finding this information valuable, please take a second to hit that subscribe button and turn on notifications. Our goal here is to empower you with the knowledge you need to take charge of your health, and your support helps us reach more people who need to hear this message. Recognizing the warning signs is step one, but taking action is what really counts. The great news is that for most people, circulation can be dramatically improved through targeted lifestyle changes. It's all about creating an internal environment where your blood can flow freely and do its job effectively. First up, get moving. Your circulatory system thrives on physical activity. Regular cardio exercise like brisk walking, cycling, or swimming strengthens your heart, making it a more efficient pump. It also encourages your body to produce nitric oxide, a fantastic compound that helps relax and widen your blood vessels. Try to get at least 30 minutes of moderate activity most days of the week. Next, let's talk about diet. What you eat directly impacts the health of your arteries. A diet rich in antioxidants from fruits and vegetables, and omega-3 fatty acids from fish like salmon can help reduce inflammation and keep blood vessels flexible. Foods like leafy greens are also great because your body converts their nitrates into that all-important nitric oxide. At the same time, you'll want to cut back on foods that clog up the system, like those high in sugar, trans fats, and heavily processed items. Hydration is another simple but powerful tool. Your blood is mostly water. When you're dehydrated, your blood volume drops and it becomes thicker, making it much harder for your heart to pump. Sticking to around 8 glasses of water a day is a great target for most people. If you smoke, quitting is the single most important thing you can do for your circulation. Period. Smoking damages the lining of your blood vessels and makes them constrict, choking off blood flow. The moment you quit, your body starts to heal. Finally, manage your stress. Chronic stress contributes to high blood pressure and inflammation, both of which are enemies of good circulation. Bringing practices like meditation, deep breathing, or yoga into your routine can help calm your nervous system and support your entire cardiovascular system. Your body is in constant communication with you. That nagging fatigue, those icy feet, that frustrating brain fog, they aren't just random glitches in the system, they are messages. They are your body's early warning system trying to get your attention before a problem becomes a crisis. Poor circulation is a silent condition, but its effects don't have to be a secret. By learning to recognize these often overlooked signs, you shift from being a passive passenger to the driver of your own health. You gain the power to listen, to understand, and to act. Don't dismiss the whispers from your body until they're forced to become screams. Start listening today. Pay attention to the patterns, make a few small but powerful changes, and most importantly, talk with a healthcare professional to understand your personal risk factors and get a clear picture of what's going on. Taking proactive steps now is the best investment you can ever make in a long, healthy, and vibrant life. Thanks for watching, and please be sure to like and subscribe to the channel.